Okay. Hi, my name is Kevin Royce Veloso. I'm a first year nursing student at Adventist University of the Philippines. And today I will be showing you a PowerPoint presentation about, it's not diagnosed, but so-called mild OCD. Okay, so this table of contents. Our first subject we'll go over is understanding mild OCD. What is OCD in the first place? OCD is a mental disorder characterized by obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, urges, or images that cause distress, while compulsions are repetitive behaviors or mental acts aimed at reducing that distresses. Differentiating mild OCD. Mild OCD involves less frequent or intense obsessions and compulsions compared to severe cases. The impact on daily life is noticeable but manageable. And common misconceptions are that it's just not about being neat or organized. It involves significant anxiety and distress that drives compulsive behaviors. Oh my God. Symptoms of mild OCD. There's obsessions. Common obsessions include fears or of contamination, harm to self or others, and the need for symmetry or order. These thoughts are persistent and intrusive. Compulsions often involve repetitive checking, counting, washing, or arranging. These behaviors are performed to alleviate anxiety caused by obsessions. Impact on daily life can affect work, relationships, and social activities, leading to avoidance, procrastination, and feelings of guilt or shame. The causes of and risk factors are environmental factors. Stressful life events and trauma can trigger or worsen OCD symptoms. These events can create a vulnerability to developing OCD. There's also genetic factors, and research suggests that genetics play a role in OCD. Individuals with a family history are more likely to develop the disorder. Then there's neurological factors. Imbalances in brain chemicals, such as serotonin, have been linked to OCD. These imbalances can affect mood and anxiety levels. And here we'll go over the identified triggers. Defining triggers. The triggers are specific situations, thoughts, or feelings that provoke obsessions and compulsions. Identifying these triggers are crucial for managing OCD. The types of triggers could be internal, such as anxious thoughts, physical sensations, or external, specific places, objects, or people. Sometimes triggers may seem random or illogical to others. Importance of identification. Recognizing triggers allows for proactive coping strategies. This reduces the likelihood of compulsive behaviors. And here's some copy triggers. A few from contamination could be germs, dirt, or perceived uncleanliness. And then there's another of order and symmetry, which seeing objects out of place or uneven can lead to arranging or ordering compulsions. And then there is harm and safety. Thoughts of causing harm to oneself or others can trigger checking or reassurance-seeking behaviors. It's important to note that these thoughts are usually ego dystonic, uh, which means inconsistent with one's values. Uh, Here's some strategies to identifying these triggers. There's self-monitoring. You can keep a journal to record the obsessions, compulsions, and the situations that cause them. Um, there's cognitive restructuring, challenge, and reframe negative thoughts associated with triggers. It helps to reduce the emotional impact of the trigger. And then there's also seeking professional help, which you could like for seek help from a therapist or the cognitive behavioral therapy. This one will go over self-regulation skills. So One second. Um, Defining emotional regulation. Emotional regulation involves managing and modifying emotional responses to achieve desired goals. Good emotional regulation helps manage distress. Its connection to OCD. Um, OCD often involves difficulty in regulating emotions. Obsessions and compulsions are maladaptive ways of managing anxiety. Importance for OCD. Effective emotional regulation can reduce the reliance on compulsions to manage anxiety. This leads to a decrease in OCD symptoms. Here's some techniques for emotional regulation. There's mindful meditation, where you practice focusing on the present moment without judgment. And this helps reduce reactivity to obsessive thoughts and feelings. And there's also deep breathing exercises. You can use this technique like diaph diaphragmatic breathing to calm the nervous system. This can reduce anxiety and physiological or physiological arousal. And then there's progressive muscle relaxation. Tense and release different muscle groups to relieve physical tension. This technique promotes relaxation and reduces anxiety. And here are some ways of applying that emotional regulation. And there is the identifying the emotions, recognize and name the emotions associated with obsessions, and this fosters a better understanding of the underlying emotional state. There's accepting these emotions, and then it's where you allow the emotions to exist without trying to suppress or avoid them. Acceptance can reduce the intensity of emotional reactions. And then there's also modifying these emotions. It's where you use cognitive reappraisal to change the way you think about triggers and obsessions. This can alter the emotional response. And here's some cognitive behavioral techniques. Uh, this is a thing called CBT. And then CBT is a type of therapy that focuses on changing negative thoughts, patterns, and behaviors. It is evidence-based treatment for OCD. Core principles. CBT helps individuals identify and challenge irrational thoughts, develop coping skills, and change maladaptive behaviors. And how this helps is exposes individuals to feared situations or thoughts without engaging in compulsions. This helps break the cycle of obsessions and compulsions. Exposure and response prevention. And how this works is by repeatedly facing triggers without compulsions, anxiety decreases over time. This helps break the association between obsessions and compulsions. Understanding this, ERP involves gradually exposing oneself to triggers while resisting the urge to perform compulsions. This helps ability to anxiety. Then there is implementing this for mild OCD. Start with less anxiety provoking triggers and gradually work up to more challenging ones. Seek guidance from a therapist experiencing this. There is cognitive, oh no, yeah, cognitive restructuring. Sorry. Identifying negative thoughts. Recognize and identify automatic negative thoughts associated with obsessions. And there is challenging these thoughts. Question the evidence supporting negative thoughts and consider alternative perspective. Then there's replacing these thoughts. Replace negative thoughts with more realistic and balanced ones. This one will go over self-compassion and acceptance. Understanding self-compassion. Self-compassion involves treating oneself with kindness, understanding, and acceptance, especially during difficult times. It includes self-kindness, common humanity, and mindfulness. It's important because it can reduce self-criticism and shame associated with OCD. Self-kindness involves being gentle with oneself instead of harsh. Common humanity recognizes that suffering is a shared human experience, and mindfulness involves being aware of thoughts and feelings without judgment. Here's some ways you can practice self-compassion. Self-compassion breaks. Take short breaks to offer yourself words of kindness and understanding. Remind yourself that everyone struggles. Mindfulness practices. Engage in mindfulness meditation to increase awareness of thoughts and feelings without judgment. This promotes self-acceptance. You could also do journaling. Write about your struggles and offer yourself supportive and compassionate messages. This can help to process difficult emotions. Acceptance and commitment therapy, ACT. How this helps. It helps individuals to engage in meaningful activities despite the presence of obsessions and compulsions. This can improve the quality of life. The core principles focuses on accepting thoughts and feelings without trying to control them. It emphasizes value-based action. And you can apply this by identifying your core values and set goals aligned with those values. And then there's also support system and routines. Uh, sorry. The importance of support. Having a support system can provide emotional support, encouragement, and practical assistance. It helps reduce feelings of isolation. How to seek support. Reaching out to loved ones and sharing your struggles. Join a support group or seek professional help if needed. The types of support are family, friends, support groups, or mental health professionals. Consider a combination of resources. Establishing healthy routines. The benefits of routines are it can provide structure, reduce stress, and improve mood. Regular activities can contribute to overall well-being. Creating a daily routine. Incorporate activities such as exercise, healthy eating, relaxation, and social interaction into your daily routine. These activities can improve your mood and reduce anxiety. And there is maintaining those routines. Stick to your routines as much as possible, even when you don't feel like it. Consistency can help stabilize mood and reduce OCD symptoms. And then there's long-term management strategies. Regular therapy sessions. Continue to attend therapy sessions to monitor progress and attend any emerging issues. Ongoing support can help maintain gains. Medication management. If prescribed medication, take it as directed and monitor for side effects. Then there's relapse prevention. Develop a plan for managing potential relapses, identify early warning signs, and implement strategies to prevent a full-blown relapse. And that is all. Thank you for listening. I appreciate your time, and I hope that you have learned something from my presentation. Bye bye.